Now firstly, let's talk about indirectly acting sympathomimetics. Indirectly acting sympathomimetics resemble the structure of norepinephrine closely enough to be transported by uptake 1 into nerve terminals, where they displace vesicular norepinephrine into the cytoplasm. The norepinephrine is then transported out of the nerve terminal by the reverse action of uptake 1 and activates adrenoceptors. Amphetamines are resistant to monoamine oxidase. Their peripheral actions, for example tachycardia, hypertension, and central stimulant actions, are mainly caused by catecholamine release. Dexamphetamine and methylphenidate are sometimes used in hyperkinetic children. Dexamphetamine and modafinil may be beneficial in narcolepsy. Dependence on amphetamine-like drugs is common. Cocaine, in addition to being a local anesthetic, is a sympathomimetic because it inhibits the reuptake of norepinephrine by nerve terminals. It has an intense central stimulant effect that has made it a popular drug of abuse. Moving on, let's discuss directly acting sympathomimetics. The effect of sympathomimetic drugs in humans depends on their receptor specificity, alpha or beta, and on the compensatory reflexes they evoke. Epinephrine and norepinephrine are destroyed in the gut and are short-lasting when injected because of uptake and metabolism. Epinephrine increases the blood pressure by stimulating the rate and force of the heartbeat, which are the beta-1 effects. Stimulation of vascular alpha receptors causes vasoconstriction of viscera and skin, but beta-2 stimulation causes vasodilatation of skeletal muscle, and the total peripheral resistance may actually decrease. Norepinephrine has little or no effect on the vascular beta-2 receptors, and so the alpha-mediated vasoconstriction is unopposed. The resulting rise in blood pressure reflexively slows the heart, usually overcoming the direct beta-1 stimulant action on the heart rate. Epinephrine by injection has an important use in the treatment of anaphylactic shock. Now let's talk about beta receptor selective drugs. Isoprenaline stimulates all beta receptors, increasing the rate and force of the heartbeat and causing vasodilatation. These effects result in a fall in diastolic and mean arterial pressure with little change in systolic pressure. Beta-2-adrenoceptor agonists are relatively selective drugs that produce bronchodilation at doses that cause minimal effects on the heart. They are resistant to monoamine oxidase and are probably not taken up into neurons. Their main use is in the treatment of asthma.